Good day, ma'am and sir. My name is Marjorie Dela Rosa from BSN 1A, and in this video, I'll be performing the proper procedure on assessing the abdomen and the musculoskeletal system. So, before proceeding to the assessment, I must do the following first. First is to assemble or gather the necessary equipments and supplies. Then, I would need to introduce myself to the patient, explain what I'm going to be doing, why is it necessary, and how can he or she cooperate. Then, I would be washing my hands and observe other infection control procedures. Then, I would be providing client privacy. Then, determine the client history on the specific assessment area. Then, I could start the assessment. Good day pa. Are you Miss Dela Rosa po? Yes, I am. Okay, so I am Marjorie Dela Rosa. I am a student nurse in here. And today I will be assessing your abdomen and the musculoskeletal system. Okay po? Okay. So, before we begin, I would like to inform you that I have already washed my hands. So, I am clean po. So, in case I would be palpating, doing a percussion, I can assure you that I am clean pa, okay? Okay. Okay, so I would like to ask you a few questions before we start the assessment proper po, okay? Okay. Okay. So, have you have any problems with your abdomen po in the past? I just feel a little bit of pain. Okay, so when was that po, ma'am? Like a few weeks ago? Days ago, months ago, or even years ago? A few months ago and a few years ago pa. Oh, okay. So, parang, before pa po, no? Yes po. Okay. So, have you had any surgeries, in your, abdomen parts? No naman po. Okay. So, in those, pain in your abdomen, have you been taking medications for those pains? Yes po. I was prescribed a medicine. I just forgot the name. Okay po, that's no problem. Okay, so for this one po, we're gonna be examining those areas in the abdomen. So later po, while I am palpating, you can tell me po whether it hurts po, okay? Okay. Okay, so again po, you did not have any surgeries po, no? In your abdomen part or in anything that involves your musculoskeletal system po, no? Yes, none po. Okay, so that is good. So I'm just gonna be preparing your part in here. So we can proceed to the assessment po, okay? Okay. Okay po. Okay, so in here, ma'am, I'm just gonna be moving you in a supine position po, okay? Okay. There, in a supine position. So, for this one, we're gonna be first examining the abdomen, okay? So, for this one, we need the client to be in a supine position with the arms placed comfortably at the sides here. There. Okay. So, for this one, we're going to be placing a small pillow beneath the knees and the head to reduce tension in the abdominal muscle, because once they are tense in here, this may be parang naga-contract siya to hold on. So, make sure that they are comfortable in the head and in the legs area. Okay, so once we have this then in a position that they are comfortable with and where we can assess the abdomen, now we're gonna be exposing the client's abdomen from the chest line to the pubic area to avoid chilling and shivering, which can tense the abdominal muscle. Diba, while we, minsan kapag nag-chills tayo, yung abdominal muscles natin nag-contract din dito. So, we're just going to be exposing them a little bit. Okay. Yan. Here, the pubic area. Okay. Now we have that one. So, I'm gonna put this. Okay, so now we have that one. What we're going to be doing is just in the inspection of the abdomen area. So in here, we're going to be inspecting the abdomen for skin integrity. Is there any wounds, any discoloration? We found nothing naman. She has a pale abdomen din naman. So next, we're going to be inspecting the abdomen for its contour and symmetry. So is one swelling? No naman. Is one more parang bulked up in here? No naman. Is there lumps and bumps in here and the other side which are not visible in here? Wala naman. So that is good. So now we're gonna be checking for distension if present. Measure the abdominal if the distension or yung parang hindi sila symmetrical, or if there's any abnormalities, it should be measured, the abdominal girth, by placing it on a tape around the abdomen at the level of umbilicus. So, in here, as we saw naman, there is nothing, so we don't need to do that one. So, what we're going to be doing next is to observe the abdominal movements associated with the respiration, peristalsis, and the aortic pulsation. Okay? So, now we're going to be observing for the vascular patterns. Oh, we don't see ano naman. Okay, so now what we're going to be doing is the auscultating the abdomen. So, we're going to be auscultating it for the bowel sounds, for vascular sounds, and peritoneal friction drops. So, for this one, we're going to be doing it in a pattern. Okay. We're going to be starting in here in the lower left. There. One. And here. And here. Now we're proceeding to the left, upper left, right, left upper quadrant naman. Okay, we're going to proceed to the right upper quadrant. Okay, then last is the right lower quadrant. Okay, so now what we're going to be doing is the percussion of the abdomen. So, in the auscultating, we have heard just normal bowel sounds din naman. So, that is good. There's no any abnormalities in that area. So for the percussion of the abdomen, we're going to be percussing in several areas in each of the four quadrants to determine the presence of tympany and the dullness. So in here, we're going to be doing it first in the lower left quadrant in here. Okay. So next is the upper right quadrant. Lower right quadrant rather. Okay, now in the upper right quadrant. Okay, then in the left quadrant. Okay, so now what we're going to be doing is the next assessment. So next what we're going to be doing is to percuss the liver. So the liver is in the upper right quadrant. So in here, we're going to be percussing it. So expose this side, it's in here. So percuss the liver. So to in percussing the liver, it determines its size, and the next is the palpation of the abdomen. So perform light palpation first to detect areas of tenderness for muscle and guarding. So, ma'am, if you feel any pain po, any tenderness, you will, can you tell me if it's painful po? Okay po? Okay. Okay. So, we're gonna be systematically exploring all four quadrants first. Okay, ma'am, I'm gonna start in lower left po. Feel any tenderness po? No naman. Okay. In the left upper, any pain po? No naman. Okay. In the right? No naman. In the right lower? No naman. Okay. Now the palpation of the liver. So we're gonna be palpating the liver to detect any enlargement or tenderness. Again, in the right upper quadrant. Ma'am, any pain po? No naman. Okay. Now, we're gonna be palpating the area above the pubic symphysis in here. If the client history indicates possible urinary retention. So, in here, the bladder rather. So, palpation of the bladder. Ma'am, any pain po? No naman. Okay. So, we're going to be proceeding to the musculoskeletal system. So, the muscles. So, in here, we're going to first inspect the muscle for size. Okay. Ma'am, I'm going to be removing it, okay? Okay po. Okay. 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 So, now what we're going to be doing is to compare each muscle on one side of the body to the same muscle on the other side. For one apparent discrepancies, measure the muscles with a tape. So in here, I don't actually have the tape, but I'll be using this first. Okay. So inspecting the muscles and comparing the muscles on each side of the body. Okay. We don't see any deformities in each side. It is equal. There, as you can see. Each side it is equal. There. Okay. So now in here, we're going to be inspecting for the muscles and tendons for contractures in here. So muscles and tendons. There's one tendon in here. Under there. Okay. Okay, now we're going to be inspecting the muscles for fasciculation and the tremors. Okay, Now we're going to be inspecting the tremors of the hand and arms by having the client hold the arms out in front of the body. So, okay. Ma'am, you can put it down na po. Okay. Now we're going to be palpating the muscles at rest to determine the muscle tonicity. Okay. Okay. It's not stiff naman. It's just relaxed, as we have instructed ma'am earlier, to just relax. Okay, now we're gonna be palpating the muscle while the client is active and passive, and the for flaccidity, spasticity, and smoothness of movement. So, ma'am, what I want you to do is walk pa. Okay. Okay. Thank you po. That is good. So now, what we're gonna be doing is to test the muscle strength and compare each side with the left side. Okay. Ma'am, what I want you to do is to hold this one po. And with the right side mo muna. Okay. That's the other side. Okay. So now what we're going to be doing is the bones. So we're going to be inspecting the skeleton for normal structure and deformity. So in here, we can see that it's just they are in symmetry naman. There's no extra finger in here. There's no swelling here or any part. This one is longer than this one. None naman. So that is good. So now we're going to be palpating the bones to locate any areas of edema and tenderness. So ma'am, I want you to tell me if it's painful po or do you feel any tenderness? Okay? Okay. Any pain po? No. Any pain? No. Okay. Now, for the joints, we're going to be inspecting the joint for swelling. So, example of that is in here. So, in here, we can see that they are symmetrical in size rather. So, there is no swelling in here, in here, in here, 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 the shoulder joint in here. No naman. Okay. So, now, we're going to be palpating each joint for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. So in here, any pain pa? No. Here pa? No. Here? No. Here pa? No. Here? No. Okay. So now we're going to be assessing the joint range motion. So we're going to ask ma'am to do a series of movements. So ma'am, can you please put your hands in a forward? Okay. Up. Any difficulties, ma'am? Anything that hurts? No. Okay. Abduct, ma'am. Any pain? No. Okay, down. Okay, how about the feet po? Here. Any difficulties? No. Other side po. Any difficulties? No. Here. No. Here. No. Very good po. Other side. Here. No. Here. No. Here. No. Okay. Okay, so that is good pa. You have a good range of motion. So now we're gonna be what we're gonna be doing next is to document the findings on what we found during the assessment on the joints and the bones and the muscles in the abdomen, the liver, and the musculoskeletal system. So that would be it for our assessment for today. We're gonna pack ma'am up. Ma'am, thank you for joining me po today po. Thank you too. Okay, can sit down na po. Okay, so that would be the end of the assessment, the proper assessment on the abdomen and the musculoskeletal system. This has been Marjorie and Dela Rosa from BSN 1A. Thank you for watching.